So could you just sort of go through perhaps the range of options, management, treatment, including non-hormone treatment that we can offer these women?
Yeah. As I always say, if you're thinking about menopause and cancer, actually the treatment plan should start way before the woman has had chemotherapy, surgery, or radiotherapy. That's because this is the time you're going to be talking to the woman about what the impact of the chemotherapy or surgery will be, what will be the impact on her fertility. As you rightly pointed out, in fact, fertility preservation is now being rolled onto NHS clinics. So we do offer it on the NHS for women who are due to start chemotherapy or radiotherapy, for example. So talking about this way ahead of their treatment starting is key. What is going to happen after? Of course, you have various arms of how to support the woman in her long-term health. Let's look at symptoms first. So if someone has a lot of symptoms during or soon after the finishing of the treatment, then of course you have HRT and non-HRT options. That could include lifestyle changes, thinking, for example, what they wear in terms of hot flushes, trying to get cooling measures around, keeping hydrated. Non-hormonal therapies, such as, for example, hypnotherapy, CBT. And again, I'm keeping it very short because we don't have a lot of time. But other non-hormonal pharmacological treatments like SSRIs, venlafaxine. We've got the new medication fezolinetant, which is the NK3 receptor antagonist. Of course, it's new. We don't know a lot about it, but one of the options for future. Then you've got other medication, the gabapentin, clonidine, which we don't often use so much. But for somebody who cannot take HRT or would not want to take HRT, every option counts in that situation. And then, of course, you have hormone replacement therapy, which, of course, we'll talk about in a minute. But HRT, estrogen, progesterone, plus minus testosterone for some women, those are the important aspects of hormones. And not to forget, local effects. For example, the vaginal effects of having radiation or having surgery, the dryness, the stenosis, taking care of that with lubricants, moisturizer, dilators, and the psychosexual aspect of sexuality following cancer. So you're looking at a whole gamut of treatments which will help these women cope with symptoms and the long-term health.